have. And who wouldn't cry if you get really sad news? That's a normal, healthy response. And we're now living in a time when many of us men have a good cry, and you know it feels good. So thank you, Bill. And we have one more call, I see.
Yes. A question from Hetty from Riverside. My neighbor just found out that she has cancer, and my children are young, and they play with the neighbor's kids all the time because we're close. How can I explain to my children about her cancer?
Talking with children about cancer is always a challenge, but essential. Can you imagine being 3 years old, an age when you can understand some things and you can talk about your feelings, or being 16 years old when you're just about to become a young adult? The cancer information can be very different then. So the first thing you want to think about is, what age is the child? You first, before you start to explain, you want to ask them if they know anything yet. Because sometimes you start to talk and the child already has misperceptions. And if you don't ask them if they've heard anything about their aunt or their mom or dad being ill, they will have very confused information. Young children, as you know, especially at the ages of between 3 and 6, they think everything happens around them. They're focused on their own needs. So they think if someone who they care about is ill, that it was their fault. So you need to help them to get information that is accurate. Now, if your child comes home and hears that a neighbor's parent is ill, the first thing they're really going to think about is, are my mom and dad safe? And so you need to let them know that, yes, sometimes people get ill, but that their mom and dad are not sick. And that you need to explain to them that sometimes people get sick, and it's not because they do bad things, but just in life, sometimes people get sick. Good, kind people get sick every day. So they need to understand that. And they will probably have questions for you. Certainly a 3-year-old will have questions that are very different. And their questions are going to be very basic. And please only answer the questions they ask. And then to let them know if they have more questions, you can talk about it. With a 3 or 4, even a 5-year-old, it may take them 3 days or 5 days to come back to you with the second question. With a 12-year-old, of course, it's very different. That you can talk with them like you would with someone who has the experience of a 12-year-old, where they have seen changes and they have seen people be sick, and they have probably even heard of people dying. But for most people with cancer, they will live a very long time, and they will live a high-quality life, and you have to let them know that. So it's important that you, first of all, find out where they are. Second of all, ask them if they have any questions, and then share small pockets of information that's directly relevant to their experience. Philosophical is not helpful, but very practical is. So I think when we have questions like this, we really have a sense that our audience thinks very deeply about these things, and this is one of the opportunities we have to really have a frank, honest, and open conversation, which is really a role model to the sorts of conversations you should be having with your doctors and nurses. That it's always based on honesty, and you know there are a lot of times when we just don't know the answers, and it's okay not to know the answers, because our relationship, the ability to talk openly about what we know and don't know, is healing in itself. So why don't we take one more call, because these questions are just really wonderful.
Yes, it's a question from Sue in Maryland. I don't want to tell people that I have cancer. Is it okay at my workplace if I just tell a few? And then, if by whatever means they accidentally or deliberately tell others in the workplace, what do I do?
One of the hardest questions is, who do I tell at work? If it's family or friends, it gets to be easier. At work, it's hard, because you must assess your work environment. You must take a step back and say, do I work in an environment where they support people who have had medical problems? Or do I work in an environment where they're not supportive? And that's one of the first questions that you must ask. Generally, you have to tell your boss, because if you do not tell your boss you have a medical problem, you will not be covered by the legal statutes that protect you. So it's important that legally, if you're going to be taking time off, that you let your boss know at least. When you're talking about your colleagues at work, you've got to decide if you are the kind of person, and this last caller seemed to indicate that she's a very private person, that she does not want to share information. It's your right not to share information, but do know people are going to be curious. So you may just want to think of a very gentle, nice way to say, I'd rather not talk about it at work, it's very personal. And so many people will say, I really appreciate that you're asking me about what's going on in my life, but it's something that I would rather not talk about here, but thank you for asking. So you let them know that you recognize that they are caring, but you have decided for you to be a private person. Other people are not quite like that. They like to share information that makes them feel better. Be honest with yourself. You have to know who you are as an individual. And if you are honest to who you are, you'll find coping easier, and you'll find people being able to read your cues better. But if you don't do anything, if you tell them nothing, they'll be confused, they will be bewildered, and you'll be more anxious, because every time they see you, they'll be confused and they won't know how to act. You have to teach your friends at work, your colleagues at work, how to respond to you. And certainly telling them you'd rather not talk about it, but thank you for asking, is one of the nice ways of doing it. So I think we have a few more calls. Why don't we go to the next call?
Yes, it's a question from Roxanne from Maine. I'm on medical leave for cancer at my work, and I'm going back to work. And my boss wants to know how they should deal with me. Should they give me special treatment or what have you?
Okay, you know, this is very important that this is our last question. And this is the perfect cycle of what we've been talking about. We started with finding out that you have cancer to going back to work. And overwhelmingly, most people who have cancer will work throughout much of their treatment. Most people will live many, many years and then will return to work. And most cancer patients who return to work will return full time. The absentee rates for people who return to work after cancer are no higher than people who have never had cancer. Actually, many of the people who return to work really appreciate life in a totally new way and really have a lot to offer, much more emotional depth and much more wisdom. No one says, I'm glad that I have cancer, but most people have gotten some benefit out of it, even if it's to redefine their value system. You should tell your boss that you're back, and if you have any limitations, short-term or long-term, you must tell them. And you need to tell them so you can work as a team, because if your boss feels that you trust him or her, you can work better as a team. The other reason is legally, for you to be protected under federal law, you have to inform your boss that you have a physical illness. So when we have a question like this, we've just come to full cycle in this brief time that we've begun to have the conversation. We've cycled from being overwhelmed to beginning to work with your family and your doctor to make and define the next steps to a plan of treatment and action and to return to normalcy. Over the next couple of sessions, we will talk about some other concerns and problems that are related to cancer. But always remember that when you go to any cancer center, make sure that for you personally, you have ways to get the information that you need, and you should always ask for a signing interpreter. And I want to thank you for these wonderful questions today. Thank you. Go to our website,